This video will demonstrate the workflow of the supervising nurse validating the documentation of administration of medications for a patient by the student nurse. In this example, we will validate the documented administration of a scheduled medication, a PRN medication, and a single dose of insulin. The student nurse was observed to use them all, and the nurse witness for the insulin administration was also present for this activity. Please note the BGL was previously recorded. All nursing staff, students included, are to ensure they always practice within their scope. The student nurse should have negotiated with you, the supervising nurse, regarding any patient cares, assessments and medication administrations prior to administering and documenting in the IEMR. As a supervising nurse, we will now validate the clinical data that the student nurse has entered into the patient's chart. For this video, we have already created a patient listing care compass and established a relationship with our patient. The student nurse has just completed documenting the medications and the nurse witness is present. The student nurse clicked Change User and we logged into the system, presenting us with our patient's chart. As the supervising nurse, our student nurse has clicked Change User and we've now logged in to the IEMR. The patient's chart for Jocelyn is now displayed on the allergies screen. We heard the conversation between the patient and our student nurse and we can now mark the patient's allergies as reviewed. They are both correct. The reviewed date and time column has now been updated. Navigate to the MAR. The student nurse has documented the insulin administration under their own Nobel login. You, the supervising nurse, are logged into the IEMR under your own Nobel login. Mary Yolo is the nurse that witnessed the insulin administration. She will sign as the witness under your, the supervising nurse's, Nobel login. The Insulin 8 Units NovaRapid Flex Pen requires a nurse witness. We'll now click on the pending validation cell. From this, we can see that Aaliyah, our student nurse, was performed by. In the witness by field, we will enter Mary's name. Mary and yourself both confirm you witnessed Aaliyah document the 8 units of insulin NovaRapid to the patient and confirm the BGL of 12.1 millimolars. When we click Sign, Mary will be asked to enter her username and password into the screen. Mary is no longer required as the last 2 medications requiring validation do not need a nurse witness. We can now validate the paracetamol. Click to select the administration cell. We confirm Aaliyah at this time and date administered 1,000 milligrams of paracetamol to our patient. Click Sign. Find the PRN for Coloxolin Senna. Click on the pending validation cell. We confirm that Aaliyah, our student nurse, at this date and time administered 2 tablets of Coloxolin Senna to our patient Jocelyn. Click the sign. All 3 actions are now complete. Refresh the MAR. The MAR has now been refreshed. The insulin NovaRapid has fallen into the discontinued scheduled section due to its once-off administration. The paracetamol administration cell now shows 1,000 milligrams authorised. The Coloxolin Senna now shows 2 tablets authorised. The 8 units also is authorised. To confirm who actually administered, verified, and witnessed the data, right-click on the cell and view details. Navigate to the action list. From this, we can see Catherine, the doctor, ordered the medication. We can see Aaliyah, the student nurse, performed the medication administration. We can see the witness was Mary Yolo, and we can see us, Alison, the supervising nurse, was the one that verified the action. We can click Close. This video demonstrated the workflow of the supervising nurse validating the documentation of administration of medications for a patient by the student nurse.